everyone, my name is Hameshi and I'll be discussing COVID-19's impact on healthcare professionals. First, we'll look at why these lessons matter. The COVID-19 pandemic exposed long-standing vulnerabilities within the Canadian healthcare system and had a profound impact on those who work within it. In this presentation, we'll explore what we've learned, what we've observed, and perhaps most importantly, what lessons have been lost as we move forward. The lesson learned was from vaccine collaboration. The development of COVID-19 vaccines progressed at a rapid pace. This achievement was built on prior research on viruses such as MERS and SARS and global funding, cooperation, and urgency, which highlight the importance of preparedness. The lesson learned was on non-pharmaceutical interventions, such as masks, physical distancing, closures, and gathering limits. The success of these measures depended on early implementation, clear and consistent messaging, and strong public trust. To be effective and equitable, NPIs were paired with culturally relevant strategies and supported by social policies like paid sick leave, mental health supports, and protections for essential workers. One lesson observed or repeated was the strain on healthcare resources such as PPE, oxygen masks, ventilators, and even disinfectants. Despite this, supply chains and stockpiling systems were never improved, and as a result, frontline workers had to ration, reuse, or improvise, often at personal risk. A key lesson observed was the lack of clear, coordinated leadership. Policies often change rapidly and without input from those on front lines, including nurses, PSWs, and physicians, who were left to interpret and apply guidelines under intense pressure with limited support. Although public health officials were working with evolving data, the absence of consistent leadership left many healthcare workers feeling unsupported, confused, and vulnerable, which exposed a deeper issue in emergency response planning. One of the most painful lessons lost during the pandemic was the failure to address long-standing health inequities. Indigenous, racialized, and low-income communities experienced significantly higher rates of infection, hospitalization, and death. In BC, for example, First Nations individuals tested positive more often, were hospitalized at younger ages, and faced higher mortality rates during the pandemic, which reflects structural determinants and a lack of culturally safe services. Another critical lesson lost during the pandemic was the urgent need to prioritize healthcare worker mental health. Healthcare workers faced intense emotional and psychological strain from burnout and moral distress to PTSD and even suicide. While burnout became widespread, mental health supports remained limited, reactive, and often stigmatized, which are issues that existed long before COVID-19 and will continue unless mental health is treated as core infrastructure, not an afterthought. Looking ahead, the lessons of the pandemic point to 5 critical areas for action. First, we must invest in health equity. Mental health must be embedded into system design. We need to strengthen emergency preparedness infrastructure, enhance communication, and build public trust. And finally, center frontline voices in decision making. Thank you for listening.